Hi and good days to examiners. Today, my colleagues and I will present how the nurses could apply their knowledge of social science into the clinical practice. Before we start, I want to introduce my group members: Elisa, Revelyn, Azatul, Azwa, Pamela, and me, Nofika. Let's start with the introduction. What is the social science? Based on the Oxford, social science is a scientific study of human society and social relationship, which the study of society and manner in which people behave and influence the world around us. It provides the vital information for government and policymakers, local authorities, and us as a healthcare provider, especially the nurses, because the nurses is most close to the patient beside their family member. Move to the next one is why is social science important in the nursing practice? First of all, to build understanding about the patient response and reaction to treatment, because patients from a different population and geographical area might give different response to a certain treatment. By understanding about the patient response and reaction, is give nurses lots of information and make the nurses more effective in providing the nursing care. Next, to understand the social circumstances from which ill health arises and how social groups are affected in different ways, like a COVID-19 disease, why the disease arises from China population and how is why is not arises from in the Malaysian population, and how is arises and affected the groups social group in the China so rapidly compared to the Malaysia. So next, to provide the nurses with knowledge, allowing them to develop critical understanding. Like I just said just now, um, by getting the information around the world, then we will study about the information and we will develop the critical understanding and critical thinking. So, the last one, but not least, the sociological knowledge prepare nurses for the challenges they will encounter. Individual from a different population or different geographical area might refuse to receive treatment or medicine because they have their own belief, and this might be a challenges for the nurses. And so sociological knowledge prepare nurses for the to encounter these challenges and to persuade the patient to receive the treatment. And that's all from me.
Hello, my name is Nur Azatul Azwa, and my part of this presentation is development of culture, which is the first cultural change related issue. Development of culture refer to the strategic planning and implementing of the strategies to leverage a unique cultural assets of our community for the economic and cultural benefit of the community as a whole. Development is not only about reducing poverty and expanding opportunities against the background of rising incomes. It is also, in a very fundamental way, about adopting a set of values that are compatible with humanity's moral development. What is culture? Culture tend to define narrowly as a customary beliefs and values that ethnic, religious, and social groups transmit fairly unchanged from generation to generation. So, how can culture be developed? Culture can be developed by change the way people work, and they will end up changing the way they think. Globalization is a one of factor that contribute to the development of culture. Due to globalization, people are more exposed to a new knowledge, high education, and access to a new technologies. As a result of globalization, people began to accept the desirability of gender equality. For example, before this, gender inequality happened in nursing profession, which is gender discrimination that people think that nursing profession just only for women, not men. But now people began to accept that men also needed in nursing profession. It is because in hospital we are also have a male patients. The male nurses is needed to ensure that male patients are well represented and more understand what their needs. But still, not all culture and people accept gender equality.
Good day, Dr. Mani. My name is Rivlin Wanifan Piran, and for my part, I'm going to present about cultural diversity and how it is related to the cultural competence among nurses. So now, what does it mean by cultural diversity? Cultural diversity exists when there is a group of diverse individuals from different cultures or societies. Usually, cultural diversity takes into account language, religion, race, sexual orientation, gender, age, and ethnicity. So next, how do all these varieties in society affect nursing care? All these varieties will trigger nurses to be more culturally competent in giving care because they are with the patients for 24 hours a day. Other healthcare providers, especially nurses, can maximize this potential by learning more about patients' culture. In doing so, they are practicing cultural competence or cultural awareness and sensitivity. The knowledge of different cultures that gives more ideas from different perspectives will enhance the collaboration, creativity, and innovation among nurses, which leads to better patient care and satisfaction. In the previous slide, I've mentioned about the cultural competency in nursing care, but what is it actually about? In the healthcare context, cultural competence is the ability to provide care to patients with diverse values, beliefs, and behaviors. Cultural competence in health system is displayed through behaviors, attitude, and policies that support effective interactions in cross-cultural situations. Nurses and other healthcare professionals should avoid making assumptions about cultures they aren't familiar with, which can lead to a breakdown of trust and rapport between the nurses and their patients, which can lead to the reduction of treatment acceptance. If nurses are unsure about something, they can just simply ask, because most people of different cultures will happily educate a healthcare provider who is willing to listen and understand their cultural differences. Nurses should be aware of social issues. Many healthcare facilities and their staff, especially those in rural areas, may not be aware that the medical sector is in desperate need for culturally sensitive healthcare. Nurses should encourage each other to provide more culturally competent care, approach sharing awareness with openness and positivity rather than from a critical point of view. Our demographics are changing, and cultural diversity will constantly develop, so the current and future nurses should be culturally competent. Here are some ways to improve cultural competence in nursing. Firstly, hiring nurses from a variety of backgrounds that reflect the changing patient population should be encouraged. This is to allow individuals with disabilities, the group with lower socioeconomic status, ethnic minorities, and immigrant groups to receive the medical care they deserve. Lack of diversity and inclusion of healthcare providers is one of the reasons these groups receive inadequate medical care. Next, nurses should improve their communication skills, including body language, and learn as many languages if they have the chance. This is to reduce miscommunication in giving treatment. Participating in online chats and networks also will contribute to the understanding of other cultures, because this is one of the platforms where the society exchanges ideas and to view things from different perspectives. It is similar to attending seminars and workshops to update our knowledge about current situations. Lastly, understanding that each patient is a unique person can help nurses effectively to interact with patients. Nurses need to have the ability to explore patients' beliefs, values, and needs in order to build effective relationships with them. That's all from me. Thank you.
Hi, I'm Elisa Idayu with TZD. My number matrix is 71093. I will explain about socio-cultural issue in content quality of life. What is quality of life? Quality of life is the general welfare of individual and cultures, outlining the negative and positive aspect of life. It includes everything from physical health, family, education, employment, wealth, safety, also security in freedom, religious belief, and the environment. Also, it's including the field of international development, healthcare, politics, also politics. Factors that affect the quality of life was influenced by the balance between ideality and reality in the lifestyles habits, which is physical activity, diet, smoking, and alcohol, and drug usage. Other than that, occupations, which is the employments and the occupational hazards. Next is family structure, which is everybody have aging populations, attention to the young to get a better life, changing of the structure of the family. For the next is socio-cultural influences on health, which is exposure and vulnerability to disease, also effectiveness of health promotion effort, also access to healthcare, and then access and ability of quality of healthcare. Other than that, I want to add in this socio-cultural influences is risk-taking behavior and also ability of healthcare.
Hello everyone, my name is Pamela and I'm going to explain about social aspects of care in nursing clinical setting. So mainly there are three important aspects of care to the patients. First of all is competency of the caregivers. Second is empathy and respectfulness of the caregivers. And the third one will be adequacy of the information that is being shared. So I highlighted the empathy and respectfulness because these are the things that patients need most of the time. So it is important to fulfill patient's social need when patient feels lonely in the ward because sometimes we are not aware whether their family members visited them frequently or not. And this one can be done by building a rapport with the patient because this thing can be settled by sitting down with the patient and spend our time by listening to them because they might need someone to hear them out when their family members are not by their side. It is quite important to be done to lessen patient's loneliness and to show respect towards the patient by empathizing, not only just by sympathizing. And mainly, this is to reduce the patient's anxiety during hospitalization. For example, when a nurse is performing any procedure on the patient, the first thing that a nurse should do is to communicate with the patient because through communication, it can help the nurse to identify, first, the side effects of any procedure that is being done. Secondly, it can help the nurse to identify other health problems faced by the patient. And last but not least, to identify patients' accurate level of pain experienced by them during hospitalization or during the procedure itself. But most of the time, communication is mainly to reduce patients' anxiety by informing about the procedure to them. To summarize all the slides just now, it is compulsory for the nursing students to apply their social science knowledge into the clinical practice. This is because they can have a better understanding about human behavior. Secondly, it can enable the nursing students or the nurses to track any area or place that is infected by infectious disease. For an instant example is COVID-19 pandemic. Last but not least, it can help nurses to specify their nursing intervention when they are doing the procedure on the patient. And here's one friendly reminder. Patients are to be treated equally without being judgmental and racist. That's all from our group. Thank you.